Shock is a state of physical and emotional distress caused by a sudden, severe, and often life-threatening event or injury. It can result from various factors including trauma, accidents, falls, violence, infection, sepsis, allergic reactions, severe burns, heart conditions, heart attack, cardiac arrest. Symptoms of shock may include pale or cool skin, fast or weak pulse, shallow breathing, confusion or loss of consciousness, decreased urine output. There are different types of shock, such as hypovolemic shock, blood loss, cardiogenic shock, heart failure, septic shock, infection, anaphylactic shock, allergic reaction, neurogenic shock, spinal cord injury. If left untreated, shock can lead to organ failure, permanent damage, and even death. Prompt medical attention is crucial. Treatment typically involves fluid replacement, oxygen therapy, medications, vasopressors, antibiotics, surgery if necessary. It's essential to recognize the signs of shock and seek immediate medical help to prevent severe consequences.